Hi everyone. Oh, I'm so excited to be back. It's another live session on a lockdown Friday night. Gosh, I'm reminiscing back to like 4 or 5 months ago. But I'm excited this evening because I'm starting off with speaking to someone pretty awesome. We are going to have a discussion with Dr. Joshua. He is a cosmetic and aesthetics doctor on Harley Street. Is very successful. He knows so much about everything in that department, and I'm really, really happy to have him on because I know that I'm very clueless to this kind of stuff. I've never had any work done on me before. I think as much as I've had done is just a very simple facial or somewhat invasive, but nothing to the point where you actually need a professional looking at your skin and really understanding exactly what is going on and how to reshape your face without really much. So I'm happy to have him on and for him to sort of answer any questions that you might have, any questions that I might have as well, because this is all new to me as well. And I think the one thing that I do like about the work that he does, it's all very natural. And that's something that I'm after as well, not now, but maybe in the near future when I do need work done to me. It's so important to find someone that, matches that natural shape to your face and doesn't really go overboard. So let me just see if he's on now and we can start chatting with him. Just waiting for the connection. Oh, this Wi-Fi. Hi,
Hello,
how
hello.
are you?
Very well. Thank you for that lovely introduction. How are you?
Very welcome. How's your evening? How's your lockdown
Um,
evening?
well, it's everything's a little bit up in the air for our profession, I'm afraid, because as per usual, we're getting some mixed messages um, of non-essential businesses having to shut down, but then all medical providers being allowed to stay open.
Yeah,
So
yeah.
there's a lot of duality in the industry at the moment. Some people are saying, well, we're medical professionals, which we are, so we're allowed to stay open. Then other people are saying, it's non-essential, which is also true.
Yeah.
So they're kind of taking it as it comes. The government hasn't made the distinction yet between medical non-essential and medical essential. So technically, there's an argument to be made that we can remain open, but yeah, at the moment I'm taking it cautiously. But we'll see. Maybe there will be a little bit more clarification. But some well-respected colleagues of mine in the industry have outright said, we're taking all the proper precautions
Yeah.
and we are open. And I think it's a good point because if you're going to be safe anywhere, it's in a one-to-one,
Of
consultation with the
course.
doctor. I
Yeah.
mean, they know all the proper precautions. I myself, for instance, and I've been doing this since June,
Mm.
I test everyone that comes into clinic.
That's good. You should,
Yeah,
obviously, for your own protection as well. Yeah.
but nobody does this.
Yeah.
You'll be, I mean, big hospitals do for hospitalization and for surgery, but even if it's like a Botox patient, I test everyone that comes into clinic complimentary. They get the antibody test, which in 10 minutes determines if you've been in contact with something in the past
Amazing.
or recently. And like I said, after 10 minutes, it shows. So I know what I'm dealing with. And so we can not just keep myself safe, but also keep the next patient safe.
No, of course. It's
Um,
amazing. It's
so
so
that's
great you do
how
that.
I'm dealing with it personally. So that's how I feel like I can stay open and still have a
Yeah.
safe environment to do this relatively non-essential treatments in. So that's what I've been doing today
That's
to actually
good.
that was a little bit of a tangent. I did finish seeing patients, and I've freed up my time for you to answer the questions that you or your followers may have.
Amazing. No, I'm glad you're still keeping busy because I guess today is one of those days where lockdown was yesterday and today's sort of the next day after that. So you don't know quite sure what to do. You've got patients, you don't have patients. I don't even know, can I go for food shopping? It's like, it's all in the air. So I completely understand.
Yeah, yeah, yeah.
Yeah,
I
yeah.
mean, the bookings have definitely decline because a lot of people are just kind of fleeing the city. A lot of my patients are now in Dubai or in the countryside. The international patients I haven't seen for 6 months, so they're having a lot of difficulty traveling in. So it's, yeah, like you said, it's pretty much all up in the air at the moment. We'll see what happens. There was a massive spike earlier before they announced, like right before the lockdown.
Okay,
Monday,
yes.
Monday, Tuesday, Wednesday were insanely busy because everyone tried. I think we're still traumatized from the last time where everyone started with their Botox going off and their roots growing out, and apparently that got some people. So they were really, really keen to get in.
Yeah, no, that's great. No, I'm glad that you're still having some sort of business, because I know a lot of people are struggling, which is really good. But for people that are just tuning in now, do you mind just doing a small introduction? Maybe I didn't do you enough justice with my introduction, so I will let you take the chair.
More than kind with the introduction. So, my name is Dr. Joshua. I'm an aesthetics doctor on Harley Street. What that means is I perform non-surgical aesthetic treatments. The bulk of what I do is fillers, so injectables to help people with their appearance, a little bit of Botox, and then some skin treatments and body contouring non-surgically as well, with like M-Sculpt.
Oh, amazing.
So amazing. Basically, no incisions, no cutting. Everything is, pretty much an in and out situation.
Yeah, wow, that's so good to hear, because I think a lot of people, especially myself, I'm actually quite happy with my appearance, but there's always little bits of inklings, of going, actually, I could make that look a little bit better. I could feel better about that particular part.
Yeah.
And
that's pretty much what I cater to. Like, I don't generally do the massive transformations. I do the polishing of what is.
Yeah.
So I don't try and change your face too much. I just try and balance it out. So a couple of things that might bother someone don't bother them that much anymore.
Yes.
You still need to look like you. Okay. Anyone that, I always tell my patients, anyone that doesn't know you shouldn't know that you've had filler. And even the ones that do know you shouldn't be able to tell that you've had anything done. They should just think, oh, you look so good. Have you had a long vacation? Have you had a good night's sleep? New skincare routine, all those things that Bella Hadid tells her followers.
Oh, that's very obvious. That's so obvious, but yeah, that's amazing, and that's what you want. And I think it's even when I go get a facial, for example, even if I do sort of like a light peel to my skin, I still kind of need about like a week to even recover from that, because your skin starts to flake, your skin starts to like.
You've got a bit sensitive skin then.
Exactly. Yeah.
Yeah.
So it's the same.
Myself as well. Anytime they say, "Oh, this needs about 3 days recovery," I'm easily 5, 6.
Yes.
I just have very sensitive
and then
skin.
the aftermath of that as well, because you do recover because it's not sensitive anymore, and then you find yourself peeling, and then you're finding yourself, you're wearing foundation and it's not sitting right, and you're like, oh my god, it's so embarrassing. I can see my skin crack, and even that like 3-4 days turns into 10, because by the time your skin completely recovers, it might as well just get a nose job.
Believe me, I've had to, and the recovery from that is quite a lot longer.
Really? Okay, wow, okay, yeah, so I have no say in that.
No worries. I've had it all done, so if you want to fire away, I'm the person to ask.
That's amazing. So I know that by following you, I know that you do use yourself a lot for testing a lot of these things and experimenting. So what are the things that you've done that you feel have improved with the structure of your face and sort of?
I feel like I'm very picky in the treatments that I choose to do in my clinic, and the treatments that I choose to do in my clinic, 95% of them have been tested on me. So that gives me it makes it easier for me to endorse something, because I've had most of it myself. My 2 favorite ones that if I had to choose 2 treatments that I absolutely could not live without, it would be my hair and my jawline. Those for me made the biggest difference. For the hair, I use PRP. So there's these things called platelet-rich plasma, where we take some of the blood and then we spin it and filter it to get growth factors out of it.
Wow.
Now, growth factors are the cells that our the cells that our body uses to restore tissue that's been damaged. So let's say you have a cut or a scrape, you know, scab forms and it heals. Growth factors are the cells that take care of that.
Okay.
But they don't heal damage by aging. So if we isolate those cells and inject them into the follicles of the hair, we can trick our body into doing that regardless. So those growth factors will enter the follicles and send signals to the body like, oh, we need healing here, we need stem cells, we need increased blood flow, and that's exactly what your body will do because it recognizes those signals. So it'll increase the blood flow, it'll send stem cells, and your follicles, they will produce thicker hair and more hair per follicle, and even inactivated follicles can be stimulated to grow new hair. And that's what I've done. I started doing that about 2 years ago now.
Right.
So when I just moved to London, my hair really, you know, I started to recede, started thinning quite a bit. It's the water quality here. We've got terrible hard water, and it's really, really bad for your hair.
You should move to the country.
I hate the commute. I'm sorry.
Oh, yes,
I
can imagine.
I'm a city boy, always have been, always will be. Yeah. I live right around the corner from the clinic in Marylebone, so it doesn't get much more central than that. But our water, unfortunately, is terrible. I started to notice that after about a year after moving, and I said, like, I'm not ready to lose my hair yet, and I'm not ready for transplant, so I kind of started looking for something that I wanted for me, and it worked so well that I thought, you know, my patients would benefit from this as well. Yeah. You might know of it as the vampire facial.
Yes,
you know, they do it in well with microneedling. You know, Kim Kardashian made it famous, as with so many other procedures, unfortunately. Yeah. But it works wonders for the hair, and that's what I use it for. So that was one of, like I said, one of the treatments. I did it every 6 months on the dot, and it works wonder for me.
So, like, so between each treatment, how quickly does your hair grow? What is sort of the process of the result?
Hair grows slowly, and this is very different for everyone. Like, I've got some hair PRP patients. I always say you need to wait 6 months to see the optimal result, because that's just, you know, how long it takes. I've got some patients that come in to get their second sitting, like after a month, because you build it up in 3 stages, once every month. Some people come back for their second sitting after a month, and they're already experiencing like a lot of hair growth, you know, a lot of thickening. So it's very different. I would say anywhere between 2 to 6 months. For me, it took quite a bit longer.
Okay.
It wasn't even me who noticed the results initially. It was my hairdresser who kept telling me, like, every time I see you, you have more hair than the last. What are you doing? I was like, I don't know. And then it dawned on me, like, that's probably the PRP kicking in. So I got her to take a picture and then compared it to an older picture of mine, and the result was jaw-dropping. I have that picture on my feed somewhere. It's a shame I can't pop it up like this.
Oh, that would be awesome. Yeah.
Actually, let me see if we can.
Sure.
I have my clinic phone here, so I have Instagram on that. Let me see if I can find it for you, because that's really one of my go-tos. And then, like I said, the jawline. It may look like I've got a pretty decent jawline, but believe me, I was not born with that.
You do look chiseled. Yes, you do have a very strong shape. I can see.
Thank you. It doesn't come naturally to me, unfortunately. I also have a picture of that, but let me try and find. So this is, I don't know if you can see that.
I can see that. Wow.
So in the before picture on this side, you can basically, like, you can see my scalp and it's quite recessed, and then in the after, you can see that it's
just grown, just completely, like, it's shifted. Yeah, that's amazing. Yeah. Wow.
So I'm really happy with that.
Yeah, I can imagine. pretty cool. I mean, that's something I don't have a problem with. I've got so much
No,
hair.
you've got great hair yourself. So
I'm good with that one, but
not the treatment we would recommend for you.
no,
You've got
not
enough.
yet. Not yet. I think
Not,
the one treatment that I might need is gray hair. I've started to see gray hair, and I'm not happy with it. So that's.
I'm afraid I'm going to have to send you to a colorist for that because we don't do that here.
Yeah, no, of
But
course.
it's not showing just yet, so.
Yeah. Oh no, not yet. You have to just like look in the light, and then it's there somewhere.
Well, let's not then.
No. But there is a question, I think, on here. I think someone's asking, what should I do to my hair? They don't say that. Oh, hold on 1 second. It's just coming through. They don't want to stay for long on the sides. They keep staying fluffy if I leave it to grow. I'm not too sure what you mean by that, but I'm assuming, are you losing hair?
Is that like a hairdresser's question or a hair growth question? Because if you're looking for the right haircut, I'm afraid I'm not your person. If you're having difficulty growing your hair, then I can do that for you.
Yes. But tell us a little bit about your jawline and your injectables, because I'm really interested about that. I myself, I have looked into it, but I don't think it's time for me yet. But the only issue that I do have with my face is that I've got quite a round face, you see, and I've got kind of like a double chin going on, and I don't know if that's maybe from the quarantine or the lockdown and the chocolate.
Well, as an avid quarantine snacker, I must admit that it doesn't do us much good. You're on the verge of what we would classify as someone with a bottom-heavy face, where you carry you seem to carry a lot of the weight in the bottom half of your face. A lot of that is because the chin is slightly set back. Okay. So it doesn't quite have the projection that ideally it should have, and that means that instead of more of a V shape, it's a little bit more rounded off. And because the lateral projection isn't quite as far as you want it to be, this bit is a little bit more prominent.
Oh, I see. That's very.
So it's not so much the area here or this; it's the thing in the middle, the chin.
Yes. So there's a question on here, and they're asking, is this treatment applicable for women over 40?
Is that pertaining to the hair, or if so, it really is, actually. Even postmenopausal, because that's a moment where, testosterone increases, estrogen decreases, which causes, thinning of the hair. And PRP is great to kind of counteract that and give it a little extra boost. Even in women after pregnancy often also experience hair loss. It's great for that as well. So there's not really an age limit there. Okay. Obviously, with men, it's a little bit different, because even though PRP can stimulate dormant follicles to produce new hair, once the follicle is dead, it's dead and we can't revive it. Then you're looking more into transplant. So if you have a receding hairline, you can stop that, but you can only bring it back very, very slightly. Right. Once you're like balding, that's gone. Oh, you can't bring that back unless with hair transplants.
That's very interesting. That's amazing. And sort of roughly, I don't know if you want to talk about this, but I'm sure you're open because you have it on your website. But what's sort of the price point, and how much do you have? Like, how much treatment do you have to purchase at once to sort of see results? I mean, your recommendation.
I'm all fine with talking about prices. Like you said, everything's on my website. I answer everything honestly. So PRP treatments for the hair, they're $500 per treatment. Okay. So as I said, the initial build-up is a little bit more expensive because you need 3 sessions a month apart. But after that, it's 1 session every 6 months. So actually, the maintenance is cheaper than having your Botox done every 3 months.
That's amazing. That's really good. It's very much affordable if you want to just say, okay, it's enough. Enough is enough. I need to do it for me, and I think it's very
Exactly.
reasonable. I think someone's also asking if you're doing any online consultations while the lockdown is happening.
I do. Not a whole lot because I find that locals mostly still prefer to come in, and there is a limit to what you can assess in 2D. It's not quite the same as an in-person consultation where I have the lighting that I want and I can assess your face from all angles. But it does give us a good idea on like what we can and can't do. I would say the online consultations are more popular for my international patients because they just have this question, I want to achieve this, is that possible without surgery? And they want to see like a yes or no, you know.
Oh, okay, wow.
And sometimes the expectations aren't that realistic. So you'll have to be honest and say like, look, I understand what you're trying to achieve, but that I cannot do for you without surgery. So I'll have to refer you to someone else. So it's not worth them flying in to hear that they
Of
come.
course not. Yes, no, completely. Yeah. So you do need
So
your
that's
online
more what I
consultation.
do online consultations for.
Yeah. Someone has an injection question. Recently,
Mm-hmm.
saw a girl have a consultation on Instagram.
An occlusion.
Oh, okay. Really scared to
Yeah.
get fillers. Right. Okay.
So an occlusion is one of the
Occlusion.
risks.
Sorry, I can't see.
Yeah. No worries, no worries. An occlusion is one of the risks of getting fillers. It's very, very, very rare, or it should be if you take all the proper precaution.
Yeah.
An occlusion is when filler gets injected into a blood vessel, and that can block the blood flow to a certain area, which can cause the skin to get necrotic, which basically means that the skin is going to die and slough off and then scar. Obviously not something you want from a beauty treatment. The very most important thing is that you go to an experienced injector who is also a medical practitioner, because only they can manage that complication. The only thing that you do with an occlusion is you dissolve the product that's been injected to restore the blood flow. So there's this product called Hyaluronidase, and it's an enzyme that dissolves hyaluronic acid fillers. If you inject that in the area in a high enough dose, that will clear the blockage, the occlusion, and that will restore blood flow to the affected area. Now, this is very time sensitive. So this has to be done very, very, very early. Luckily, any severe occlusion is luckily picked up fairly quickly and can be treated either the same day or within 12 or 24 hours. I always say, I tell my patients this, anything you need to be on the lookout for is anything that gets worse instead of getting better.
Right.
So when you've got some fillers, obviously you've had some injections, you might bruise a little bit, you're going to swell a little bit, that's perfectly normal. The worst of it is the morning after. You wake up, you're a little bit more puffy, you're going to have your maximum bruising. From that point, everything should be getting better. Anything that gets worse, discoloration that gets worse, pain that gets worse, or swelling that gets worse, are alarm signals. If you experience any of that, you need to go see your practitioner, or at least send them a picture of what's happening. Only medical practitioners can administer dissolvent. That is correct, because the hyaluronidase is a prescription medication.
Right.
So I have it in stock here. I have about 10 vials minimum every time in case something happens. But if, like, let's say, in the UK, it's a little bit of the Wild West for injections, where legally beauticians, etc., are also allowed to do this, but obviously they're not allowed to prescribe, so they don't have things like hyaluronidase in stock, or corticosteroids or adrenaline injections, if someone has an anaphylactic reaction or anything like that. And also, you need to have someone with the proper training to recognize the difference between what is a bruise and what is a vascular occlusion, or a vascular compromise.
Yeah, wow, there's so much that you need to look out for. Have you experienced that before with any patients that have come to you from someone else, or?
Actually, I'm more than happy to talk about these kind of things because every doctor out here has complications. A doctor that says he doesn't have complications is either lying, he's not capable enough to recognize that he's had a complication, or he thinks the complication looks good enough and isn't actually a complication.
Right.
Like, that's it.
Yeah, everyone makes mistakes at the end of the day.
Or you're so new and have done so few cases that you haven't had a complication yet. So everyone's had this. What I remember from my last one is you sent me a picture. It was a rhinoplasty, and there was a little bit of mottling in the skin. And I said, you know, this should be treated as soon as possible.
Yeah.
So about 3 hours, 4 hours later, we had her back in clinic, dissolved everything, followed up with pictures, just, you know, sending me, she just sent me her pictures every morning, noon and evening, just kind of seeing it heal. She get the right prescription, get the right ointment, and within about 4 or 5 days, everything cleared up perfectly. There was no permanent damage, and that's how it should go.
Right.
I've also seen this happen in other situations where they message their doctor and say like, oh, you know, I have this going on. And, oh, it's just a bruise, put some ice on it, which is the worst thing you could do because ice actually impedes the blood flow instead of stimulating it. So vascular problems, you want to give aspirin, you want to put heat on it because you want to stimulate.
You want to thin it out. Yeah. Yeah.
So they actually, you know, they go to these people who don't really know how to deal with occlusions. If it does happen, they give them the worst possible advice, making it so much worse. And then, you know, they kind of, it's not getting better. They come into contact with someone that does know what they're talking about. So like, you need to come in immediately and have it dissolved. But if it's day 4, 5, 6, those tissues have been without oxygen for about a week. There's a very high risk that that will lead to permanent scarring.
Right. Oh, wow.
You know, the patient that I was talking about, bless her, she left it for 3 days actually before contacting me. So I you know, that was already a tricky situation. Now, luckily, because we, you know, flushed the area with Hyaluronidase, gave proper wound care, even gave her LED light sessions to stimulate wound healing and, you know, skin perfusion. And even after 3 days, everything healed perfectly fine, no discoloration, no scarring. But ideally, she should have messaged me the next day, yes.
Oh, and for example, if something does happen like this to someone that comes in and has a has something done, you dissolve it. How much time do you need to go back and say maybe she's still not happy with her nose or she wants something else done? How long do you have to give that?
I mean, if you've had a vascular compromise, I would leave it at least a month. Usually, I would say after dissolving, you need to wait 7 days because you inject an enzyme that dissolves a filler. So people sometimes think, oh, I'm going to get my lip filler removed and have it put back in straight away. You can't do that because there's dissolving agent in there. Any filler you inject is obviously going to get dissolved.
Yeah.
So the product lingers in the tissues about 5 days. So I always say after 7 days, you can have it re-injected. Now, obviously, in this situation, you need to leave more time because you want those tissues to heal properly because it's quite stressful for the tissue to be without oxygen for 3 days. So yeah, a month after you can.
That's amazing. That's so much that you have to deal with yourself in clinic as well. And I guess it's so stressful even afterward. You're thinking, okay, I hope my patient's doing okay.
This is what's most important. This is what's most important. It's not about beautiful before and after pictures or, you know, amazing reviews. It's what if it doesn't go right, you know, and that can be as minuscule as, oh, you know, I had my lips done and I like them, but there's a little bit of a bump, or it can be, oh, I have a vascular occlusion in my nose and I might have scarring.
Yeah.
If that happens, how your doctor reacts to that is what kind of doctor you're dealing with. You know, anyone loves praise, anyone can post, you know, brilliant reviews and beautiful patients on their Instagram, but it's when it goes wrong, what are they going to do? Are they going to step up, or are they going to be like, oh, you did this, you did it wrong? Like, so often do we hear these things, like people who went somewhere, so like, oh, I have a bit of a bump in my lip. And like, oh yeah, well, you probably bit it, or you probably like pinched it, you did this. Like, no. That's no way to talk to a patient because you're still, you know, oh, all right, it's aesthetics, but you're still a doctor. You still have a duty of care. The very least you could do is either give them an explanation or see them for, a checkup.
Yeah, of course. Wow.
So, but this happens very, very often, unfortunately, from what I'm hearing from the patients coming.
No, of course. And what do you find that is your most popular thing that people come in to see you for? What is it? These days anyway, because it changes, I'm sure.
That really depends on what everyone's known for. So there's a lot of more well-known doctors that have their niches.
Yeah.
With me, it's really become the eyes. People come and see me to have, the eyes in general done. So that can be the tear trough, it can be the eyebrow, lifting that, changing the shape of it, or it can be the upper eyelid. Now, I'm very happy doing the eyes because I love it. It makes the biggest difference in your face if your eyes are a bit hollow, sunken, or a little bit droopy.
Yeah.
To kind of, refresh that, polish that, because that's the first impression. Many scientific studies have proven the very first thing we see is someone's eyes. Within like a millisecond, we've scanned that.
Yeah.
So it's obviously very important that our eyes look on the outside the way that we feel on the inside. We'll have sometimes 27-year-olds with these big tear troughs or these big hollow grooves underneath the eyes, constantly looking tired. People asking them, "Oh, are you okay?" I mean, you laugh, but it can be really.
I know what you mean. Yes.
Really difficult for some people to deal with.
Yes.
And it makes such a difference to kind of be able to take that away. I've actually worked with a lovely girl, Marie Lou, recently, who's she's this big influencer on Instagram, and she came to me with that exact problem.
Wow.
And she made the most thorough video about it. It's on her YouTube if you want to check it out, about explaining. She had the tear troughs as well, and she walks you through the whole process of just how it made her feel, how people react to it, and then all the things that she did research-wise that led her to to come to me. And then she filmed the whole consultation, the treatment, aftercare, everything. It's really a compact but thorough kind of experience of what everything's like. And it was really interesting for me to see as well, like the other side, because I see people walk into the clinic and I try and make it as much of an experience for them as I can. But everything that led up to that was really interesting to see.
Well, I have to see it. I have to check it out. Yeah.
Really
I don't personally have that issue with my eyes. But I will definitely, it's interesting to see the process anyway, and to see the sort of before and after.
Journey in general was very interesting to see. And she has, she has this charisma, this way with words that just presents everything. Yeah, I was really impressed with that.
That's good. That's amazing. And what other things have you done to yourself apart from the hair in your jaw? What? Because I think with everyone that's within their field and they're a professional within their field, you sort of take advantage of that, and you're like, okay, I need to look my best. I need to be the biggest advocate for what I do all the time. So what are other procedures that you've done?
I have done a lot. I've already popped up to the hair and the jawline. I've had some nasolabial fillers. I have lip filler. I used to have some under eye filler, but I had that removed because with age, my eyes are getting a little bit puffy as opposed to hollow. So it was a little bit much. I have quite a bit in my cheekbones as well. I've had a little bit in my mid-face. I've had 2 surgical rhinoplasties, which unfortunately didn't really end up being too successful. So I've had the liquid rhinoplasty with filler to correct that. I have Profilo, which is like a bit of a filler mask, actually, a really thin layer of filler underneath the skin. I've had some Botox all around, but that's pretty much worn off now. What else?
How old are you, if you don't mind me asking?
I'm 29.
You're 29. Okay, wow. You still have loads of time before you can. You need a whole bunch more stuff.
I'm just about one of the youngest doctors in the industry, and definitely beyond on Harley Street.
Congratulations. That's a huge compliment.
Thank you.
Yeah.
Thank you. What else have I had? I've had Morpheus, which is a microneedling radio frequency for just general tightening of the skin and texture improvements. And that's about it. Yeah, some skincare, some supplements.
Yeah, of course. I think there's a question. What can you say about the thread lift?
About thread lifts. Thread lifts is a phenomenon that has boomed incredibly in the last 2 years, I would say. And I find that it's a bit of a problematic thing because they're over-promising. First of all, there's a lot of things going on about like fox eye threads. You must have seen this.
Yes, of course.
And they're saying like, oh, Bella Hadid thread lifts, Kylie Jenner eyes, stuff like that. And it's very important to know that none of these women have had this procedure done.
It's just makeup. It's makeup and other fillers, right?
It's makeup and surgery.
Oh, yes, sorry.
You cannot lift a face or a brow with threads, and I'll tell you why. To lift, you need to either remove tissue or you need an anchor point. Threads have neither of that. So the way that a thread lifts work is they enter it into the skin, they pull it, and then they enter it out, and then they kind of, tighten it. And it's got like these little hooks so it doesn't slide back. And that all sounds very lovely, but they don't anchor it anywhere. When you're doing a facelift, you're stitching the tissues up, you're anchoring them to the SMAS, how do I say this in layman's terms? To just the connective tissue. You stitch it, you anchor it. Because otherwise, gravity's just going to pull that down. If you put a thread in your face here and you pull it out here, what's keeping it up?
Right.
Are the little hooks going to keep it up? No. Everything is just going to come back down. And this is what we see. When you're seeing thread lifts presented on Instagram, the only thing you're seeing is a before and an immediately after. You have never in the history of before and after pictures seen a 6-month after result from thread lifts, because I'll tell you why, there isn't one. I trained in threads myself. I thought I was about 2 years ago, I thought, oh, amazing opportunity, I'm going to train in this, because it really helps, tighten that jawline. It's a niche that filler doesn't always reach if there's a little bit of excess skin. And immediately afterwards, the patient looks amazing. I thought I had reinvented the facelift. Surgeons can pack up and go home. And then I see her for a 3-month review, and we're both just staring at each other slightly, awkwardly, just thinking, well, can you see it? I can't see it. And she's like, yeah, I can't see it either. Now, this was a model patient, so she had just paid the cost of the treatment.
Yeah.
But that's not, you don't want to see someone 3 months out and then have them be like, I guess I can kind of see it. Like, that's not what you want. I want people coming back like, oh, this is amazing. Whatever you've done, keep doing it to me. And that's the difference with fillers. A good filler will last you 9 to 12 months. That's a big difference. The thread, a good thread lift, Harley Street prices will be about 2,500 to 3,000 pounds.
Yeah.
Filler-wise, you can get a lot of procedures done for that amount that you'll still see 9, 12 months out. The thread's completely gone in 3 months. Not only that, it's dangerous because it creates scar tissue around those little threads. So if at some point in time you're going to want to have a surgical procedure done, the surgeon is going to have to maneuver around that, sticky scar tissue, trying to remove that thread. That can cause asymmetries. It can cause more scar tissue. And then we haven't even talked about the complications that you can have. Swelling, reactions, granulomas, puckering of the skin, dents or dips. I have a whole highlights in my stories about thread lifts. I think it's called fox eye threads or something. Things that people have messaged me, because I talk about this a lot on my stories. Because
you're very passionate about it, I can tell.
I definitely oppose thread lifts, and I don't think anyone should ever have them done. If you want your face tightening non-surgically, there's a lot of options that can do that. If you want the actual vertical lift, surgery does that, and only surgery. And don't let anyone tell you that Bella Hadid has had thread lifts, because women of that caliber don't waste their time and money or their face on something as dangerous and unscientific as thread lifts. It just doesn't work because it can't, because there is no anchoring.
Yeah, no, of course. It makes
If you think about it logically, the physics of it, it just cannot work.
No, I can even picture the actual procedure, and I'm sure that if you do watch it, it looks quite painful. And I think I've seen it at some point. I don't know where, but I've seen someone doing it, and it looks painful. It looks
being done.
Yeah. I don't know. I mean, I know that I wouldn't put my face through that. That's 100% sure.
Well, I've put my face through a lot already. Like, I'm not worried about the pain factor. I'm worried about the risk versus reward.
Yes.
The risk is very high, and the reward is absent. You know, you look at it for a couple of weeks.
Yeah.
That's not worth it. You know, it's certainly not worth the money.
But then it doesn't even heal. Like, how does your skin really heal in 2 weeks anyway, to even see the
Well, it's not the skin so that's healing as much as the subcutaneous tissues, like the tissues underneath the skin.
Yes. But surely you see, because like anything that you do to your skin, or you do to anything of your face.
That's the problem. Sometimes you can actually like see the threads, like when they're smiling, or you can see like cables or dimples or bumps of that thread kind of like pushing into the skin or the scar tissue that's formed there.
Yeah. Oh, okay. So we have some questions. So what's the filler alternative to threads?
So a lot of people are going out there saying like, oh, liquid facelifts and filler lifts, and we have to be quite honest with that, in that filler doesn't lift. We used to think it does, so that people used to think, oh, if you fill the cheeks enough, it's going to lift the jawline. It doesn't. There is zero scientific evidence that it does. But if we use the right injection techniques and restore volume in places that lost volume, then we can make a lot of areas appear lifted, you know, jawline, cheeks, and eyes. And because I specialize in eyes, so I'm always going to kind of divert towards the eye area, I've created this technique where I can do that, you know, eye shape change and that eyebrow lift, moderate lift, with fillers, actually. So not only is it far more predictable, it's far less risky than a thread lift. And because it's all hyaluronic acid fillers, it's completely reversible in case something does go wrong, or in case you just, you know, for some reason don't like it.
Yes.
So because the fox eye threads annoyed me so much, but I couldn't get around the fact that clearly there is a big demand for like we call it canthal tilt. So tilting the eyes upwards slightly with a lifted eyebrow. Yeah. There was a massive demand for it, apparently, because these young women are putting their face through horrors of thread lifts to get that done. So I think, like, how can we do this safely? You know, the most common option is just surgery, but there's a lot of people who just don't want to have surgery, or who don't need it yet. You know, they're too young. So I've come up with this filler technique where we add filler to a couple of strategic places in the upper eyelid, the lower lid, underneath the eyebrow, and sometimes the temple or lateral forehead, which gives that, you know, that pull and slanted look. So yeah, it's definitely possible.
Right, that's good.
It's difficult. So only see, like, you know, practitioners that specialize in fillers around the eyes, because that is probably the most tricky area to get. So much so that a lot of people just don't even treat it. I get a lot of referrals from colleagues saying like, oh, you know, if you want upper eyelids or eyebrows done, you know, go see him, because I don't touch that.
Oh, wow. But that's good. Yeah. That's good for you.
It's good for me, yeah. And you know, it further solidifies my niche of eye treatments, which I love. So I'm not complaining.
Yes. There's another question, and someone's asking you if you're going to be open during November, and how do you lift the tip of your nose?
Both good questions. Open as it stands at the moment, with the information we have now, yes. Because it clearly states medical businesses are allowed to remain open. You know, I'm a doctor, I have a medical degree, I'm registered with the General Medical Council and have medical indemnity. So they don't make the distinction between essential medical or non-essential medical. So until more clarity comes on that, or until they, you know, release a statement saying that we do actually have to close down, with the information that we have now, we are allowed to remain open. And as I mentioned before, I don't know if the person asking this question was there to hear that, I do coronavirus testing for all patients that come into clinic. So even if you're having a consultation or just having some Botox topped up, you get coronavirus tests just to see if you have any antibodies, late stage or early stage, so to see if you have had it in the past or if you may still be infectious. Now, luckily, I've only had 2 patients test positive for possibly infectious. And, you know, that's easy. You reschedule, you know, they keep their mask on. And I have this fogging machine in clinic that produces a disinfectant mist. And we just fog down the whole room. So it keeps not only me safe, but it keeps the next patient safe as well.
That's amazing.
So that's how we're managing to stay open without putting people in danger.
Amazing. And the next question is, how do you do a lift of the tip of your nose?
Tip lift. There's a couple of different ways to do that, and this is actually really, really nifty. So the primary way is you kind of create a fake new tip on the top. So the nose is constructed of, the tip is constructed of 2 cartilage kind of horns here. And if you inject right on the top of that, it will just gently rotate that upwards, creating a new tip over your old tip, and the tension of that will kind of pull it back. And then you blend that in with the bridge of the nose by micro injections right above that, just to kind of soften that transition. Otherwise, it looks like, you know, a little cherry on top. Another way, but this only works in people with certain anatomies, is sometimes the little bridge here, what we call the columella, is indented, and that will always make your tip look droopy. And then we can add a bolus of filler underneath that, which brings this out. And then instead of looking like this, it looks like this. So it makes your tip look lifted. Even though you haven't actually physically lifted the tip, you've pushed that columella out, and that's changed the angle to make it, instead of like this, look like this. So that makes it look like your tip is standing up higher. So those are two of my favorite techniques through which we can lift a tip with filler. And it can also refine, so sharpen a bulbous tip, which is lovely.
That's awesome. Oh, wow. I knew there was something along those lines, but I didn't know that it was exactly that. So that's pretty good to know.
Yeah, now you know.
Yeah. So there's another question. How many, sorry, I can't see it on the screen. How many mils do you use for a rhinoplasty?
For rhinoplasty, that really varies. So rhinoplasty is probably the one procedure where we're not really looking at how much it's really a see as you go treatment. Right. So sometimes that could be 0.2, sometimes that could be 0.8 or even a full mil. But you just regard it as a treatment, not as, let's say when you're having your lips or your cheeks or your chin done, you're paying, you know, for a syringe.
Right.
Syringe is 1 mil, some syringes are 1.2, and then you pay for that. But with rhinoplasty, you're paying for the result. So whether that's 0.4 or 0.8, you know, the price is the same, but you pay for the results. Then sometimes, you know, you get a couple of injections, and then you have some swelling as well in the end result. So sometimes once the swelling goes down, people, like after about 2 weeks, they'll think like, oh, the tip isn't quite as high anymore, or my bump came back a little bit. You can come back for a top-up at the 3 or 4 week mark for free to have that topped up, because as I said, you're paying for the results, not for the treatment. Whereas with lips, you know, if you have your lips done, you have the full syringe, you have 1 mil, and then sometimes, oh, I want a little bit more after 1 or 2 months, that's fine, but that obviously isn't included because that's an entirely new treatment because you've paid for the syringe.
That's amazing. I did not know that's how you do it.
Not everyone works that way. You know, some people, they do charge for top-ups, but I just find that this way works. It produces better results because you don't accidentally overfill someone that may have just some swelling.
It doesn't go to waste if you don't, you know.
Exactly. Nothing goes to waste. Nobody gets accidentally overfilled. And people that do have swelling, they haven't paid for their nose to look good for just 3 weeks, you know?
Yeah, no, of course.
So everyone's happy.
That's good. Well, that's what makes you different from other practitioners in your field. So that's great. Yeah. We have one more question. With Botox, to lift your brow, when the Botox wears off, can the eyebrow drop more than before?
No, it can't. That's physically impossible. So let me, very good question, because a lot of people think this. Let me actually get a prop in here to explain. So Botox is a muscle relaxer. So Botox injected into a muscle makes that muscle not work as much anymore. So for a brow lift, we want to target the muscles that pull the brow down, so the depressors. We've got the orbicularis oculi here, which is a round muscle around the eye. And then we've got the depressor and the procerus here in the frown. Those are all muscles that pull the eyebrow down.
Yeah, I've got that.
So if we inject here, then we're going to disable that part, the outer part of the orbicularis muscle that pulls the eyebrow down, and then it doesn't do that anymore. So then you get this minor lift. It's never going to be comparable to a surgical lift. Like a Botox brow lift will get you 1 or 2 millimeter lift, just a slight release. And I always say it's more of a release than an actual lift, because we've disabled that muscle that pulls it down. So once the Botox wears off, slowly that muscle will become more and more active again, and it can pull back down a little bit again until after a couple months full power to that muscle is restored and you're back to square one. It's not going to droop because there's no anatomical or physiological basis for it to be higher than it was before. If anything, it will be, for it to be lower than it was before. If anything, it will be higher because during X amount of months, you haven't had that pull down.
Right, I understand.
And a lot of people think, this is probably a question that's going to follow, is if I have that done, do I need to keep doing it? Because otherwise, like, is my face going to implode or anything? Yeah. And it's not, because as I said, if you stop using your Botox, it just, the muscle strength just gradually restores over a couple of months, and you're back to where you started. It never gets worse. If anything, it's better afterwards because you haven't had that movement or that pull during the time which you have used Botox, be it months or years.
That's amazing. Again, another thing, you live and you learn.
There you go.
So many great
That's
things.
why we're here.
So just to conclude everything, for example, me, I've never had anything done to my face. Yep. And I'm such a virgin to this whole aspect of doing things sort of non-invasively to your skin. And I've always been kind of like, I don't know about fillers. I don't know if it's the right thing for me. But if someone like me wants to go in for a consultation and just say, do what you need to do to make me look better, do you have to go in specifically knowing exactly what you want, or can you actually come for?
Absolutely not.
Okay.
I actually prefer that people don't.
Yeah.
So on my website, you cannot book your treatments. You can book your consultation and we will discuss the treatment. You can have the treatment, that's fine, but you don't solely decide what you need, because people will be booking in for things that they completely don't need. So I always stress the consultation more than the actual treatments. Right. It's much more important that we talk about what is bothering you, and then you vent about what's bothering you, and I give my professional input saying we can improve that via X, Y, Z, and then together we decide on a treatment plan with you knowing what bothers you and me knowing what's best to treat, explaining that to you so you can see like, hey, that makes sense, let's do that. So you are part of the decision-making process, because it is your face, after all.
Of course.
But if you just look in for like, I want a brow lift, I'm going to book in for a Botox brow lift. When you come in and I see that you have severely hollow temples, so that's never going to look good on you, I would be like, well, maybe before we do Botox, we restore some volume in that temple, because that will pull your brow back, and you might feel like you don't need that Botox that you need to top up every 3 months, whereas the filler lasts you a year. So that's why I don't like it when patients decide treatments on their own. They book for a consultation, and then we see what they need. Now, obviously, it's different if they've already had consultations with me before and we have their notes and their treatment plan, but still, everyone books in just a consultation online. That's it.
Have you ever had any patients come in pretty young and you going, actually, you don't need anything, I can't do it?
All the time.
All the time.
All the time.
Okay.
Not necessarily for age, because I find that that's not as much a problem as people want you to think it is. You know, the amount of 18-year-olds that are pushing to get filler isn't that high as they want you to think it is.
Yeah, okay.
It does happen occasionally, but it's very, very rare.
Yeah.
Reasons where treatment is refused is if you're just not the right patient for that treatment, like it's not going to do what you want it to do, or if you are over expecting what it will do for you. Like people saying, oh, I want a Botox brow lift because I really like it when my eyebrows are like this.
Yes.
First of all, that looks horrible. Second of all, that's not going to happen because that's just not what that does. I know there's a lot of people on Instagram that have really good at photography and angles and lighting to make things look like they're God knows what when they're not. But then sometimes you have to sit them down. It's like, look, what you're asking from me without surgery is not possible without surgery. And then you have to explain to them why, because otherwise they're just going to go next door and have it done with someone else. And then they're going to come back to you and correct it because it's not going to work.
Oh, that's
terrible. It happens, unfortunately.
Yeah, you've had that experience.
All the time. All the time. Because when I will say, you know, this isn't right for you, because X, Y, Z. And it's very important that I say because such and such and such, and that I try and read, does this patient understand why it's not good for them? If they don't understand, then they're going to go somewhere else and they're going to have it done. And the next one, you know, he might also say, oh, you know, this isn't for you. Or they might walk into the door of someone that's a little bit less ethically motivated and a little bit more financially motivated that might say, oh yeah, that's fine, we'll do it for you, come in, inject, and out. And then, you know, after they complain, it's like, oh, you know, this is your fault. And they've had their money.
Yes, yes.
No, it happens a lot. And then they'll contact you and say like, oh, you know, I saw you for that, but you said no, and then I had it done. Can you, you know, and now look at this, and they'll send this picture of God knows what, and then like, can you help me? And you can, but it's frustrating because a lot of what we do is you know, or a lot of what I do is
I'm sorry, I don't mean to laugh. I'm just reading the comments that are coming through. And I'm seeing just people going, no, but I want to look like Bella Hadid. Like, what? You can't do it for me? I think I've watched...
Not with fillers, I'm afraid. She's had some fillers, but most of it's surgery.
I think I've watched enough botched, you know, the surgical procedure show to know that sometimes things are just not right for you.
Even the smallest treatment can go very wrong. Yeah. And you need to find someone that knows what happens or what should happen when it goes wrong and how to protect you from making it go worse. Pretending that nothing's going to go wrong isn't saving the patient at all. You know, telling them, oh, it'll be fine, nothing's going to happen, that's not helping. You need to explain, if something happens, how are we going to, you know, how are we going to see that this needs treatment and how are we going to treat it?
Yeah.
That's it. It's easy as that.
That's amazing. Well, it's been lovely speaking to you. I think we're going to be logged off by Instagram. We can sit here all night chatting about this and answering questions. But if you guys do have any more questions, he is on Instagram, and I'm sure he'll be lovely enough to answer them for you. And pop in for a consultation. I think I might do that. I think I might do that just to see what I can do to my face. Because, like I said, I've never done anything like that before. But I'm sure like this, like, you know, heaviness of my face needs sorting out soon. If either weight loss or coming to you. But yes, no, I know you're giving your professional, you know, opinion about it, and I appreciate it.
Well, thank you so much for having me.
It's been lovely.
Sorry for ranting.
No, you're passionate. That's it. You're passionate. And I get like that as well. If you ask me questions about what I do, I can speak until the sun goes up. So it's fine.
There you go. But
Yeah.
that was kind of the goal.
Yes. No, of course. Well, listen, it's been lovely speaking to you and getting to know you a little bit more. And hopefully we'll meet soon and sort this out.
Not quite that bad.
Ah, thank you.
If you ever feel that itch, you know where to find me.
Perfect. All right. Well, have a lovely evening. Enjoy your weekend, and we'll speak soon.
Thank you. Have a lovely weekend.
Bye.
Bye.
Bye-bye. Thank you, everyone, for joining. It's been so lovely speaking to Dr. Joshua. If you do want to answer any questions that you might have for him, do send him a message his way. And if you have any questions for me, I'm happy to answer them anytime. Make sure you tune in next week, and we'll see you then. Bye.